In this video, we're going to talk about piriformis syndrome. What the heck is it and how do you know if you have it? My name is Dr. Andrew Grecki, back pain specialist. I work with a lot of people that have been told they have piriformis syndrome, and so today I want to help you understand what the heck that is. So let's start by understanding what is the piriformis. Well, here it's a muscle, right? So it sits right here. Right here. How about that? Don't even have the right one. We can find it. There it is. Nope. Right there. Nope. Right there. Nope. Still not right there. Where the heck is it? Gonna have to start this video over again. There it is. All right. Maybe not. We'll just keep it rolling. All right. So piriformis syndrome. We got a muscle right here. This is called the piriformis. And why do we care about this? So we're going to hide others. Oops, not hide others. We're going to get rid of, we're going to fade the others so you can kind of just see where this is coming from. Yeah, that looks kind of weird. So we've got the top of the hip, the femur right here, this bone. Muscle goes all the way from there across to the pelvis or the sacrum. You see the sacrum right here? That's the bottom of the spine. Why do we care so much about this muscle, right? If I get rid of these things, maybe that'll make it a little more clear, right? Let's get rid of that. Let's get rid of this. Let's get rid of that. Okay, here's why it matters. If I get rid of these guys, to make this a little more clear, again, here's our piriformis muscle. Well, if I put the nerves in here, wow, look at that. So there's a big fat nerve. It's called the sciatic nerve. See how that nerve goes right underneath this muscle. Now, again, if I hide this muscle, see that nerve? That's a big nerve. Muscle goes right over it. Now, people that have what's called sciatica or pain down the leg, numbness, tingling, weakness down the back of the thigh, all the way to the foot and ankle, that's sciatica. The sciatic nerve is being irritated, and it can be irritated anywhere along its path. So it could be irritated in the spine itself, or it could be irritated from this muscle, this piriformis muscle. If this muscle's tight, it can squeeze on this nerve. So how do we know? How do we know if it's piriformis syndrome or sciatica or if it's a back problem? And I'm going to give you a really, really easy way to figure this out. If you put this muscle on stretch, how would we do that, right? Well, you would take the leg and cross it over the other side. Anything that's going to put this area. So basically moving your hip. If moving your hip makes the sciatic pain that you're feeling down the leg more intense, it's most likely piriformis syndrome. If your hip is moving and it's not creating more of the symptoms, then it's probably not the piriformis. I know that kind of seems like a silly thing, but this is very, very common, and hopefully that helps. So in my next videos, I'm going to talk about what to do about it, but there you go. That's a quick description of what piriformis syndrome is. Hope that helps. And if you want to learn more about it, watch more videos.